Hi, so I'm Jim Lewis. I'm Director of Surgical Pathology here at Vanderbilt University Medical Center and a head and neck pathologist. And one of the things you'll know about our service at Surgical Pathology at Vanderbilt University Hospital is there's what a diversity of material. You know, patients have the most broad and unusual things, from the most common simple things to some of the most complex diseases and specimens that you can even imagine. And it is all here at Vanderbilt University. And this is what you learn from. So our residency surgical pathology rotation is completely subspecialized. We have 7 benches. We have breast, bone, soft tissue, and skin, thoracic, which includes cardiac pathology and also some general surgical pathology specimens. We have GYN, we have GU, and then we also have our head and neck endocrine. And amongst all of those benches, you get a very broad experience. 4 weeks on each bench as a resident, and then there's an intro month. So the total, it would be 32 weeks of surgical pathology just within our subspecialty framework.
My name is Sophia Celeria. I'm the chief of the GI, liver, and pancreas section, and I also serve as the director of the GI, liver, and pancreas pathology fellowship. We're a very busy service. We see approximately 11,000 biopsies and over 2,300 resections a year. The cases are a nice mix of complex and bread and butter cases with neoplastic and non-neoplastic pathology. The GI pathology faculty are very invested in teaching. There are 7 dedicated GI pathology faculty that you will rotate with. In addition to learning from them, you will also learn from the GI pathology fellow.
Hello, I'm Jennifer Gordetsky, Dr. Gordetsky. I'm here to tell you about the GU Fellowship, which is Genitourinary Pathology Fellowship. One of the great things about this fellowship is that it allows our residents or folks who have undergone maybe a general surgical pathology fellowship or a fellowship in another area to really hone their experience and expertise in the area of genitourinary pathology. We see nearly 5,000 urological specimens a year because we have so many referrals of patients from around the Nashville area, which means we see a lot of patients and we review all of that pathology.
We have 5 general surgical pathology fellows. And this is really an advanced fellowship in the sense that you really become the communication focal point for what we do. Communication with the docs that submit specimens, the teams at tumor boards, with the teams at clinical pathologic conferences where pathology is presented, and really especially with the operating rooms. So the surgical pathology fellows all do a number of weeks, almost 9 to 10 weeks of general surgical pathology frozens. And as a frozen section fellow, you are the point person for what goes on in the operating room as it relates to pathology. So anything intraoperative consult, it all runs through you as the frozen section fellow. And that's a lot of responsibility. The general fellowship also rotates you through a number of major benches, all the subspecialties that we have. The other part of it, an average of about 8 to 10 weeks of what we call flex or elective time, of which we schedule you for usually at least 6 weeks of bigs. But it can be anything else that we do. So cytopathology, neuropathology, dermatopathology potentially, and then research time as well.
You will be graduating and you will have achieved experience in research. You know, whether you're going to go into an academic setting or even if you're going into a community practice, just the experience of going through that research process is really invaluable.
There's numerous opportunities to learn as we love to teach. We're highly invested in your education and love to teach at the scope, through formal lectures and unknown conferences. And anytime there's an interesting case, we're always here to show it around, whether it be in the sign-out room or through at the scope teaching.